Hi everybody, I'm here today with a colleague of mine. She's a psychologist from the United Kingdom and she practices in pain management and she has so much to say about pain management. Welcome, Harbinder.
Thank you, Andrea. Thank you for having me today.
You're welcome. Can you tell me about what you do and where you practice and what you do there?
Yeah, sure. So I'm a professor of psychology. I split my work with doing research, so trying to help people live better with their pain. So developing science and testing different management strategies to increase the evidence so we can help inform clinicians that are working with people.
So you are a
with pain.
scientist in psychology and psychology of pain.
Yeah.
So you try to find new ways that people can manage their pain and why is this important in pain management to have a psychologist doing this type of work?
Yeah, that's a really good question. So for pain, we know it goes beyond the physical sensation of pain. And it's a long-term condition. When we say chronic pain, we mean long-term pain. And for a lot of people that have to live with it for day in and day out, it can impact so many other parts of their life. So beyond the physical body, it can impact relationships. It can impact who they are, their identity. It can impact emotions. It can impact whether someone's able to do their work and fulfill their roles, whether it's within the family,
taking care of their children.
Taking care of their children. And that impact can be devastating and really change someone's life. So just treating physical pain and missing everything else.
That's why we need this part of the health psychology, and that's what you do?
That's what I do. So I'm a professor of health psychology, so I come in very much with the psychological aspect of pain management, and working in a team with clinicians is important. So it's not in isolation.
So they send people for you to see from a pain clinic or from another clinic? They ask you, can you please help this person?
Exactly. So I work with clinicians, pain physicians, physiotherapists, nurses.
How long does it take for you? For how long do you work with these patients? Is it a couple of sessions or is it a long time?
Yes. So normally it's more. We need more than a couple of sessions, but there's two kind of answers to that question. So one of them is the challenges we have, and quite often the psychologist will see a patient towards almost when they have exhausted all of the avenues of looking at trying to...
When they already tried everything.
And then it's sort of the end resort, let's see the psychologist. And that could be quite challenging in times because I have to try and build that relationship or trust with my patient and explain why psychology is important, because actually it's about managing pain and helping you to have the best quality of life that you deserve. That it's possible. And in terms of sessions, like typically we see them in a pain management program. They vary in length, but they could be 2 or 3 sessions over several weeks, because again that helps us to build that relationship and explore all the different complexities.
So would you say that it would be better if those patients have come to you earlier, much earlier in their journey of chronic pain, instead of being the last resort?
Absolutely. I think that way we are genuinely working as a team, and we can explore all the management skills at the beginning and try and help people to start implementing those.
And what is that you teach? What is that you do with them and for them, and you teach them that I know it's a long, it's a lot that you do. Can you summarize for us a few things that you teach them?
Yeah, sure. So the first thing we help patients do is to explore. And when I mean explore, it's try and gain an understanding of the impact the pain is having on them. Because quite often patients may not realize, because they're living in this turmoil of life, lots of things happening. And when we start to break down, okay, let's look at you and let's look at all the different elements. it helps them join the dots. It helps them realize actually
they didn't notice that it was the pain impacting.
And it's, you know, quite central to everything that's going on. And then we employ different techniques. So it might be that we challenge more of the thought processes. You know, what do you feel and what do you think, and how is that affecting your behavior, and these might have turned into habits over time. So we try and perhaps adjust those and rationalize some thinking.
That's great.
And quite often it's a lot about identity. It's very easy to lose who you are because the pain takes over. So I sometimes say to patients, it's not about going back to your old identity. Instead, let's rebuild who you are.
So important.
Rebuild your life. And pain is a part of this life, but it doesn't mean it drives your life. And that's a hard concept to understand, but it's something that we work on with the patients.
Some people don't believe that that's possible.
But it's about living well with the pain. And we know it can be done. And this is where the scientific side of me...
We saw the patients getting there, changing their life, so we want to motivate a new patient that comes to us, say it is possible. I've seen a lot of people like you and who turned their life to the other side, and
and it's very challenging. It's not easy. The journey isn't easy. It's not as straightforward. It is pretty much like this. And we normalize that. So we say it's okay for that to happen, but we're there to support. We're there to see you through the journey.
Excellent.
We're there to give you the skills you need. We're there as a sounding board as well.
Yes, exactly.
And one of the other elements is, when we talk about support, is the family network. So bring
the family to the sessions.
Bring in the families, bring in your carers, bring in your friends, because they're a part of your journey.
You're talking to them only 1 hour there, but their friends, their family are there, can support them all the time.
Exactly, because quite often communication is the one thing that's broken down. How do you explain when you have pain? How do you say, I'm not having a good day today? You know, if you've committed to something with your family, but actually you're not feeling quite up to it, you've had a bit of a flare up the day before.
You need a break.
You need a break, but how do you communicate that without feeling guilty, without feeling like you're letting people down?
So tell me a little, your profession is fascinating, but there might be some challenges and some rewarding experiences. Can you share with us some of your most challenges that you have, and also some rewards that you have from your profession?
Yeah, sure. So I think the most challenging aspect of my profession is a misconception of what psychology is in pain. And to be honest, the first sessions I have is normally going over that and sort of, you know, all these kind of misconceptions that people have, and reassuring that psychologist means the pain's in my mind.
It's not real.
It's not real. I'm not being believed. My clinician doesn't believe me. So it can affect the relationship there as well, which is why it's really important that I have the time to explain why psychology and why they've been referred to me, and how we can help build that quality of life. And I think what's really rewarding is seeing people change through the journey, and really seeing them have that hope again. Because quite often a lot of people lose the hope. And when we talk about acceptance, it's not giving in. It doesn't mean I give up my life and the pain is taking over. It's learning to define acceptance, and learning your values and being able to live with the pain.
Yes, excellent. Is there anything else that you'd like to tell our audience today? Yeah,
I just think in terms of managing pain is not to give up. There are, you know, people like myself and yourself and great clinicians and teams, and we work really hard behind the scenes with our science as well as our clinical practice to really help and hopefully give the message that you can live well with your pain. It's very challenging, but you know, we are here to help.
Thank you very much.
Thank you.